Thank you.
Please.
Photo.
The camera. Sir, in the back, sir. Sir. Okay, sir.
Founder, Executive Director, KauveryHospital, Radial Road. Along with Dr. Ravindan Selvaraj, I also invite Dr. Sridhar and his entire team, doctors fraternity, nursing fraternity, technicians who has been instrumental in getting this place up and ready and running also. Of course, the press and the media team who has accepted our invitation and being here. In those 2 years, a lot of things have happened. When we started the Institute of Brain and Spine, we of course, Dr. Sridhar was very clear that it has to be an integrated unit where surgeons, neurologists, interventional neuroradiologists and non-interventional neuroradiologists, along with the rehab team, and of course the nursing fraternity as well as the technicians, has to be together in this mission. Of course, I think whatever we thought through, I think we are already there, and we are still sailing and progressing, cruising at a very rapid pace. That's what I would say. Today, so not only is a day of 2 years of Institute of Brain and Spine, we are also opening new avenues. That's a specialty clinics. That's what we are planning to launch today. In the last 2 years, what is so welcoming and heartening is the Institute of Brain and Spine team has touched about 25,000 lives. That's a huge milestone. People who has come to this place with a lot of fear and uncertainty have walked out of this place with hope and life. That's what Institute of Brain and Spine is for KauveryHospital and Radial Road. Thank you, sir. Once again, I welcome everybody for this event. Thank you.
Thank you, Mr. Karthik, for kickstarting today's event. Next, we have Dr. Krish Sridhar, Group Mentor, Neurosciences and Director, Institute of Brain and Spine, KauveryHospital, Radial Road, the President-elect of the Neurological Society of India, who is a visionary neurosurgeon and mentor and has led the growth of neurosciences at Kauvery with pioneering work in brain and spine care to take us through the journey of KIBS over the past year. Over to you, sir.
Thank you very much. Good morning, everybody. It's indeed a very, very good morning because 2 years have just flown by. I mean, it is as though we've just started and it's already 2 years. And when we were thinking about what has been happening, we couldn't just imagine that it's 2 years. And then when we looked at what we have done, we then decided it's about time we go to the next step. And for that, I must thank the KauveryHospital leadership. Dr. Ravindan Selvaraj is here. He, Dr. Chandrakumar, Dr. Manivandan, and all the others have been extremely supportive in all our visions, what we want to do, where we want to be. And for that, I'm very, very thankful. I think this cannot happen as a single person. So, this is May 2021 when the respected Chief Minister inaugurated this hospital, and that was our team at that time. And this was in August 2021 when the Kauvery Institute of Brain and Spine was inaugurated, and that you can see has become a bigger team. And now our team, and these are only the doctors, our team is huge. You can see that it not only has surgery, neurology, neuroanesthesia, critical care, neuroradiology and intervention, rehabilitation, neuro-oncology, behavioral neurology, because the concept which I think is very important in neuroscience when you're dealing with either brain or spine is that there has to be an integrated care. It cannot be one person treating the patient, because if it's only one person treating the patient, you lose something somewhere and the patient goes a little dissatisfied because the completeness of care, because ultimately we are treating a patient, a human being. So I think that is the concept that we have brought, and I must thank my colleagues and all the others who have been involved in this journey for the last 2 years for carrying on and believing in this vision of integrated neurocare. We of course offer all elective and emergency services, and I'm very proud to say that we have consistently got the gold certification from the World Stroke Organization for our work on stroke. And that is why we are now ready to get AI into stroke services, and I think we'll be talking about that a little later. In this 1 year, from last August to July, we have treated over 10,000 patients in the OPD. We have treated more than 1,600 patients in the IPD. Our 24-bedded neurocritical care unit has treated more than 1,800 critically ill neuro patients. That's the amount of work which has happened, and I must give credit to the very, very hard-working nurses, staff, doctors of the critical care unit, because neurocritical care is different from other critical cares. It's very difficult. Unless you are there and see it, it's very difficult. Of course, we have done 600 plus major brain and spine surgeries, and for that I give credit to my team of neuro and spine surgeons who have been with me and we have worked together in doing this. We have not only done clinical work, we have also conducted many programs, educational programs. We have done 2 major conferences, one a neurocritical care conference and one a neurosurgical conference. And we have conducted also workshops to teach and learn amongst our peers, a microsurgery workshop and spine endoscopy workshop, because we are now specialists in these. We have got many visitors from across the country and the world who have come here and who have sort of applauded our efforts, our work, and we are very proud to say that we are well known across the country and across the world. But it is not a journey that ends today. It's a journey that continues towards excellence. Spine deformity, movement disorders, and deep brain stimulation surgery, epilepsy surgery. There are so many things where there is so much that needs to be done, and therefore that's why we thought the time has now come. We have matured, and therefore the time has now come for us to start specialty clinics and give more focus to problems, certain problems which need that focused work and which is sort of lacking in healthcare overall. So I think because this team is there, this big team is there which can focus and work on these problems, we are now able to give this specialty clinics to society so that these patients can be helped. We can help more patients, we can do better, we can serve better, and we can keep up the Kauvery Brain and Spine Institute dream. Thank you very much.
Hospital. Congratulations. Can you all please give a big round of applause? You appreciate with your care staff. OT technicians represented by Money. For the skill and focus that power every safe procedure. Thank you, Dr. Emmanuel Das, Dr. Satish Kannan, and Dr. Selvin. Next, I would like to invite Dr. Ponnaya, Dr. Sindhupriya, and Dr. Muthukumaran to join us in recognizing neurocritical care unit staff represented by Sarah, Vignesh, and Emmy Moll.
Come.
Congratulations to you. Next is intensive care unit technicians represented by Vijay Kumar and Santosh. We all can have some energy in congratulating you. Thank you. Congratulations. Thank you, Dr. Ponnaya, Dr. Sindhupriya, and Dr. Muthukumaran. Next, I would like to invite Dr. Subramaniam, Dr. Lakshmanan, and Dr. Swati to please come forward in recognizing the electrophysiology technicians represented by Balaji. Congratulations. And thanks to Dr. Subramaniam, Dr. Lakshmanan, and Dr. Swati. Next, we would like to invite Dr. Sriram Varadarajan to please come forward and join us in recognizing radiology technicians and staff represented by Suresh and Surya. More energy. Thank you. Next, it is Cath Lab team represented by Felix. Congratulations. Thank you. I hope you keep up the energy in the entire felicitation. Thank you, Dr. Sriram Varadarajan. Now I would like to invite Dr. Arulmozhi and Dr. Venkatraman to please come forward and join us in recognizing the neuro rehabilitation team represented by Mr. Shabir. So they help in getting patients back on their feet. Congratulations to the team. And thanks to Dr. Arulmozhi and Dr. Venkatraman. Next, I would like to invite Dr. Smirna and Dr. Meena to please come forward and join us in recognizing ward and ER staff represented by Ms. Priyanka and Ms. Chitra. Congratulations to you. Next is the physician assistants team represented by Gayatri and Maheshwari. Congratulations. Thanks to Dr. Smirna and Dr. Meena. Now I would like to invite Mr. Karthik Ramamurthy to please come forward and join us in recognizing the KIBS, Kauvery Institute of Brain and Spine admin team represented by Mr. Leslie Samraj. This energy is because you are a fan club for it. Thank you, Mr. Leslie, and thank you, doctors, for recognizing the efforts of our dedicated neuro team. Thank you so much. From debilitating conditions like trigeminal neuralgia and chronic facial pain. This clinic offers specialized interventions and long-term relief. Next comes the Parkinson and Movement Disorder Clinic. This clinic focuses on advanced diagnosis and treatment for Parkinson's disease and other complex movement disorders, including therapies like deep brain stimulation and Botox. There we go. Next, it is Spine Deformity Clinic for patients with scoliosis and kyphosis and other spinal deformities. This clinic brings world-class expertise in minimally invasive and corrective spine surgery. Here we go. And now it is Epilepsy Clinic. This clinic is dedicated to comprehensive care for epilepsy patients with advanced medical and surgical management for both adults and children. Here we go. Big congratulations to Kauvery Institute of Brain and Spine on this landmark step forward. A huge round of applause to the entire team. Thank you so much, doctors. Thank you so much.
2 o'clock. You got scans coming in, and the AI can actually triage and give you there is some critical finding in it, which then the expert doctors can finalize and say this patient requires acute care. So this is the first priority. The next is actually optimization of workflow. Imagine the patient lands up in a smaller hospital. Imagine that the facilities there can treat a minor stroke. Very often, sorry. So stroke, 3 minutes, okay, is going to be my speech given the time given to me. But let's put it this way. Every 2 seconds, somebody in this world is having a stroke. Every 6 seconds, somebody is actually dying of stroke. As much as there is awareness on cardiac conditions, stroke awareness is abysmal, which means we have a lot of work to do. And what we plan to do with AI is very simple, just a two-pronged attack. All we want to do is accelerate stroke diagnosis, which means AI does not replace doctors or radiologists. Using the AI algorithm, AI is also going to integrate the treatment paradigms in the workflow. So now the doctors sitting at a major hospital can actually inform them this patient requires higher order care, more critical advanced treatment. So now this patient, instead of getting shifted the next day, will get shifted overnight. And every minute counts in stroke. Every minute, almost 2 million neurons die. And this is irreversible. So I would put it this way, AI is going to be a game changer in assisting the stroke team to accelerate care, improve our workflows, and optimize treatment outcomes. So this is our entire approach towards introducing this AI in our stroke service. And I thank the Kauvery management and the entire KEEPS team for having us, accelerate these technological advancements. And this, my dear friends, is the future. AI and predictive analytics is going to rule the game in healthcare, and we are so proud that Kauvery is at the forefront of this revolution. Thank you so much.
Thank you, Dr. Sriram, for showcasing how innovation is transforming patient care. Now we are honored to invite our chief guest for the day, Dr. Aravindan Selvaraj, co-founder and executive director, Kauvery Group of Hospitals, who is one of the driving forces behind KauveryHospitals with a mission to make world-class healthcare accessible to all. Please come forward and deliver the address.
The team behind this Kauvery Institute of Brain and Spine Surgery to celebrate the second anniversary. It's definitely a moment to celebrate. There's no doubt about that. As Dr. Sridhar sir was telling, I asked him when we are felicitating so many people, how many people are there in the team? So he told nearly 90 people. So that's why it's called an institute. It's not a department, it's not a clinic. You have an institute, and with so many subspecialties and super specialties, you need large number of people across different categories, caliber, and expertise. One is the doctors. And Kauvery as an institution, really we are very proud that the institute is led by the well-renowned neurosurgeon nationally, is the president of Neurological Society of India, and this Kauvery Institute of Brain and Surgery is led by Dr. Sridhar. Thank you, sir. And one of the things you would have noticed, one of the key departments which will predict the outcome after any neurological problem like stroke or anything is the critical care. I've always known neurocritical care by Dr. Ponnaya. It's one of the excellent team. I didn't realize when Dr. Ponnaya came and presented with such a large team. In fact, we are asking, do you need so many members in the team? But to provide this specialized care, I mean, as a surgeon, we can operate, but who provides the ultimate outcome is the anesthesia and the rehab and the post-op team that is provided by Dr. Ponnaya and the team. And it is not that the surgeon and the physician and neurologist, of course, they are the anchors. Imaging as well, Dr. Sriram, Dr. Satish and the team. So, and it is apart from the doctors, when we are felicitating, there is the neuro monitoring team, and then the EMG nerve conduction studies team. There are so many teams, the rehab, physician assistants. All of you are important in giving this outcome. It's not like a standalone individual clinical practice. This kind of institute can be done only in very few reputed hospitals in the country. And I'm glad that the Kauvery stands right at the top under the able leadership and also with the excellent clinical work that we do. Mr. Karthik was telling how many lives we have touched in the last 2 years, 25,000 lives. That's not a small number, that's a very, very big number. Dr. Chris Sridhar social media handles follow pannina. There's so many patient stories. It's just not the numbers. How many individual lives we have touched? I personally know so many of my doctor friends and then patients got treated by Dr. Sridhar and the team with the excellent outcome. And also not only from Chennai, Tamil Nadu, this institute attracts patients because globally, we all know cardiology, oncology, these are well-established departments, orthopedics, whereas neurosciences is still an evolving department. It takes years and years to get trained in either neurology, neurosurgery, or neurointerventions. And then we are fortunate to assemble this big team under one roof. That's why we are getting patients from all over the world to provide this outcome. And it's not that we want to do a good service and then establish the department and institute and walk away. And Sir has told we have done 3 international workshops. I personally, I was fortunate enough to participate in one of the workshops, minimally invasive endoscopic spine workshop. So even standard spine surgery gives good results. But what is next? That is the improvement in the technology and the expertise. And we want to adapt the new technologies, and also we want to, it's not that we want to keep it to ourselves, we want to give it to the next generation of doctors and also the other institutions as well. This training culture, the constantly learning culture, that's what keeps the institute up and alive. The standalone clinics department, they do the job and go. What is the institute? I adapt to the new technologies, new expertise, and new techniques, but I will also train the next level of people and also share our knowledge with other people. That's why the institute stands apart. We had a lot of debate to call it as a Department of Neurosciences, DONS, or another brand name, but anyway. So that's why it's called an institute where the clinical excellence thrives and the people constantly learn, adapt to the new technologies, techniques, and then also teach the next generation of doctors and also share it with our colleagues. And Dr. Srinath was mentioning artificial intelligence in stroke. As I said, neurosciences, still a lot of things are happening. No individual specialist can keep track of what's happening. And with such an advancement in artificial intelligence happening, there can be only two type of doctors or two type of institutions going forward. Doctors who use AI, doctors who don't use AI. See, you can never get away with without seeing a doctor or the healthcare professional, but you are better off seeing a doctor or institution or the hospital which adapts AI. That's very, very, very important because it cannot, any one of the clinical care providers cannot shy away from using the technology. And that's where this institute is a pioneer in adopting this artificial intelligence in stroke management. Because stroke management, how critical it is. See, I was speaking to the facility director, Mr. Karthik, this morning. We have tied up with a lot of hospitals in the surroundings, in the neighborhood, or in the Chennai region. Many hospitals with a slightly smaller facility, avungalukku round-the-clock CT scan and round-the-clock specialist radiologists, and availability of the neurologists and neurointerventional radiologists or neurosurgeons irukka maatanga. So they do the images, and then those images are shared in a common group because the stroke is a symptom. Stroke symptoms irukku. It can be due to several causes. One வந்து இந்த கழுத்துக்கு போற ரத்த குழாயில கரோட்டிட் ஆர்டரி அடைப்புனால இருக்கலாம், அல்லது வந்து கிளாட் வந்து பரவி இதயத்துல இருந்து ஹார்ட்ல கிளாட் பரவி அந்த நர்வ் பிளட் அந்த பிளட் வெசல்ஸ் அடைக்கலாம், அல்லது ப்ளீடிங் இருக்கலாம். There are so many reasons. பட் அந்த கரெக்டான டயக்னோஸ் கிடைச்சாதான் does this patient needs a thrombolysis, அந்த கிளாட்டை டிசால்வ் பண்ணி கரைக்கிற த்ரோம்போலைசிஸ் பண்ணணுமா, இல்லை இந்த கரோட்டிட் ஆர்டரி அந்த சர்ஜரி பண்ணுமா, இல்லை பிரெயின் சர்ஜரி பண்ணுமா, பிரெயின் ப்ளீடிங்க்கு வெரி வெரி இம்பார்ட்டன்ட். If you thrombolize on a wrong patient, it will further accelerate the stroke or the symptoms. Sometimes patients can die. So that's why these images, the CT scan images, immediately to share among the groups, and artificial intelligence tool analyzes. Because artificial intelligence has analyzed millions and millions of the scans throughout the world. It can, to absolutely close to 100% accuracy, it can predict, is this a stroke symptom, or is this due to the bleeding, or what is it due to? So there's no time wasted. And getting a neurologist to see the scan, and he comes with, he asks for further studies, and my time la waste pannama, quick decision. And I wish the people highlight about the stroke management, the window period abdin solite. So we always know about heart attack abdin solite. Whereas in the brain attack, because once a stroke is not managed properly, the long-term disability, one for the patient பார்த்துட்டு இருக்க அந்த caretakers-க்குமே it's a significant impact. So a proper stroke management, if you are in a good institute, if you are taken care by the good specialists in that institute, the stroke outcome, the prompt intervention, either by neurointervention or the surgery, we can give the patients almost back to their normal life. 100% we can get them back to their normal life. That is very, very important. How many times we have seen that the patients would have survived the stroke, but still suffering from a lot of disability. And avangala paathuட்டு irukanga, the caregivers, either wife or parents or the son and daughter, the stress on the caregivers is enormous. That's why prompt stroke management, with the help of artificial intelligence and with the help of a specialist in an institute like this, will go a very long way. So it is definitely a momentous occasion. I don't think we had as big celebration as this for the second anniversary of the hospital, I think. Did we have? So the hospital ஆரம்பிச்சு 2 years, 3 months ஆகுது. அதை விட இந்த பெரிய celebration, the Institute of Brain and Surgery, because it deserves this kind of celebration. Kauvery Hospital, Chennai, 2012 we started. Ever since I have been always brainstorming with my doctor colleagues. ஒரு சென்னையில் வந்து இவ்வளோ பெரிய சிட்டியில் ஒரு வந்து வெல் நோன் இன்ஸ்டியூட் ஆஃப் பிரெயின் அண்ட் சர்ஜரி, இன்ஸ்டியூட் ஆஃப் நியூரோசைன்சஸ் இருக்கான கிடையாது. associated with Dr. Sridhar, Dr. Ponaya sir and the team. And then I wish them very, very all the best, and I congratulate again the 90-member team. Thank you.
A consultant whom we really admire, not just for his clinical work, but also the way he plans for his department's growth with such exceptional, clinical care. But also you always raise the standards and keep the benchmark very high. So thank you so much for the entire neurosciences team. And many thanks to Mr. Karthik, our facility director, for his constant support, and all those who have helped us behind the scenes today. And special thanks to our media friends, for sharing our journey to the wider community. And as we conclude, let us remember that excellence is not just an act, it's an habit. And today we have seen and we have witnessed that habit has transformed into milestone. So thank you all so much for joining in our journey. Nandri, Vanakkam.
Kauvery Institute of Brain and Spine, KauveryHospital, Radial Road, Kovilambakkathilende, Vanakkam. Today we are celebrating 2nd anniversary of our inauguration here in this hospital. The Kauvery Institute of Brain and Spine oda speciality enna idhula nariya departments of neuro and spine undu. Idhula nariya specialists irukanga. And idhula naanga vela seiyra vidham eppdina integrated neuro care appadina ஒரு பேஷண்ட்டை ஒருத்தர் மாத்திரம், ஒரு டாக்டர் மாத்திரம் ஒரு கிளினிக்ல பார்க்குற மாதிரி இல்லாம நிறைய பேர் யாரெல்லாம் பார்க்கணுமோ, ஸோ மேபி நியூராலஜிஸ்ட் பார்ப்பாங்க, ரீஹாபிலிட்டேஷன் பார்ப்பாங்க, ரேடியாலஜி பார்ப்பாங்க, எல்லாம் பார்த்துட்டு அதுக்கப்புறம் அவசியம் இருந்தால் சர்ஜனும் பார்த்துட்டு ஃபைனல் ஒப்பீனியன் பேஷண்ட்டுக்கு எது பெஸ்ட் அந்த டீம் டிசைட் பண்ணி பேஷண்ட் கிட்ட அந்த மாதிரி ட்ரீட்மெண்ட் கொடுக்கறது தான் இன்டிகிரேட்டட் கேர்னு பேர். இதனால என்ன நடக்குதுன்னா பேஷண்ட்டுக்கு பெஸ்ட் அவுட்கம்ஸ் வருது. ஒரு பேஷண்ட்டுக்கு எப்படி நல்லபடியா ஒரு ட்ரீட்மெண்ட் கொடுக்கலாம், அதோட ரிசல்ட் நல்லபடியா இருக்கணும். ஸோ அது பெஸ்டா வரத்துக்கு இதுதான் ஒரு நல்ல மெத்தட். ஸோ தட் எல்லாரோடையும் பெஸ்ட் தாட் அதுல போய் பேஷண்ட்டுக்கு பெஸ்ட் ட்ரீட்மெண்ட் கொடுக்க முடியறது. இது நாங்க பண்ணி இப்போ 2 வருஷம் ஆறுது. இந்த 2 வருஷத்துல நிறைய பேஷண்ட்ஸை ட்ரீட் பண்ணியிருக்கோம். இங்க நிறைய அட்வான்ஸ்ட் கேர் பண்ணியிருக்கோம். நியூரோ கிரிட்டிக்கல் கேர்லயும் சரி, நியூராலஜிலையும் சரி, நியூரோசர்ஜரிலையும் சரி, ஸ்பைன் சர்ஜரிலையும் சரி. அதனால என்ன ஆயிருக்குன்னா இப்போ இந்த டீம் ரொம்ப மெச்சூர் ஆயிடுது. இப்போ 2 இயர்ஸ். ஸோ இந்த 2 இயர்ஸ் மெச்சூரிட்டியில இப்போ நாங்க என்ன ரியலைஸ் பண்ணோம்னா அடுத்த ஸ்டெப் நம்ம போனோம். எப்படின்னா 2 விஷயம் பண்ணியிருக்கோம். ஒன்று ஸ்பெஷலைஸ்ட் கிளினிக்ஸ் அப்படின்னா சில விஷயங்கள், சில நியூரோ அண்ட் ஸ்பைன் பிரச்சனைகள் எடுத்து அது மேல ஒரு ஃபோக்கஸ், ஒரு ஸ்பாட்லைட் கொடுத்து அந்த பேஷண்ட்ஸுக்கு ட்ரீட்மெண்ட் எப்படி நம்ம எடுக்கிறது கொடுத்தா சொசைட்டி வில் பெனிஃபிட் பெட்டர். ஃபார் எக்ஸாம்பிள் எபிலெப்சி ரொம்ப பரவலான ஒரு ப்ராப்ளம். ஃபிட்ஸ் வருது. பட் நிறைய பேருக்கு இந்த ஃபிட்ஸ் கண்ட்ரோல் ஆகாம இருக்கும். ஸோ அந்த எஸ்பெஷலி குழந்தைகளுக்கு இந்த மாதிரி இருக்கிறச்ச அடுத்தது என்ன பண்ணலாம் இந்த குழந்தைகளுக்கு. ஸோ அது ஒரு ஃபோக்கஸ்ட் ஒரு கிளினிக், ஸ்பெஷாலிட்டி கிளினிக். ரெண்டாவது ஸ்பைன் பெண்டா இருக்கலாம். அந்த பெண்ட் ஸ்பைன் அது வேற வேற விதத்தினால, கன்ஜெனிட்டலா இருக்கலாம், வயசான காலத்தினால இருக்கலாம், ஒரு கட்டி இருக்கிறதுனால இருக்கலாம். எந்த காரணம்னாலையும் அந்த ஸ்பைன் பெண்டா இருந்தாக்க எப்படி அந்த பெண்ட் ஸ்பைனை நம்ம சரிப்படுத்துறது. இதே மாதிரி முகத்துல வலி ஒரு ரொம்ப ஆக்சுவலி இட்ஸ் குவைட் காமன். பட் நிறைய பேர் அது மேல பேச மாட்டாங்க. அதை பத்தி ட்ரீட்மெண்ட் ரொம்ப பிட்ஸ் அண்ட் பீசஸ்ல ஆல் ஓவர் த பிளேஸ். ஸோ அது ஃபோக்கஸ் கொடுக்கணும். அதே மாதிரி பார்க்கின்சன், நிறைய பேர் கேள்விப்பட்டிருப்பீங்க. பார்க்கின்சன்னா கை நடுக்கும், உடம்பே ஸ்லோ ஆயிடும். ஸோ இதுக்கு இதெல்லாம் ஒரு ஃபோக்கஸ் பண்ணி நிறைய பேர் ஒரு டீமே அதுல ஃபோக்கஸ் பண்ணி இன்வெஸ்டிகேட் பண்ணி
evaluate பண்ணி ட்ரீட்மெண்ட் ஃபோக்கஸ் பண்ணாக்க பேஷண்ட்ஸ் வில் கெட் பெஸ்ட். அங்கே ஓட வேண்டாம். See, மெயின் இஸ் நான் கிளினிக்கில் பேஷண்ட் பார்க்கலாம், பட் அடுத்தது ஏதாவது வேணும்னா இன்னொருத்தர்கிட்ட வெளியில் அனுப்பணும், வேற இடத்துக்கு போகணும். ஸோ அதை வெளியே ஓட வேண்டாம். ஸோ டுகெதர் ஒரே ரூஃப்ல we can give the patients the best treatment and management plan. Apart from this, stroke வந்து ஒரு ரொம்ப பரவலான ஒரு பிரச்சனை, as common as a heart attack. பட் யாருமே இதை பத்தி அவேர்னஸ் ஜாஸ்தி பேருக்கு தெரியாது. அதனால என்ன ஆகுதுன்னா, ஒரு பேஷண்ட்டுக்கு ஒரு ஸ்ட்ரோக் சிம்டம் வந்ததுன்னா பி ஃபாஸ்ட், பேலன்ஸ், ஐஸ், ஃபேஸ், ஆர்ம்ஸ் அண்ட் லெக்ஸ் அண்ட் ஸ்பீச், இதுல எதுலையாவது ஒரு பிரச்சனை வந்ததுனாலும் லேட் பண்றாங்க ஹாஸ்பிட்டலுக்கு வரத்துக்கு. ஏதாவது ஒரு சின்ன நர்சிங் ஹோம் போறாங்க, அங்க வந்து அங்கேருந்து ஒரு ஸ்கேன் வெளியில எங்கேயோ எடுக்கிறாங்க, அந்த ஸ்கேன் ரிப்போர்ட் வரத்துக்கு வெயிட் பண்றாங்க, அதுக்கப்புறம் ட்ரீட்மெண்ட்க்கு போறாங்க. ஸோ எல்லாமே லேட் ஆகுது, படிப்படியா லேட் ஆகுதே போயிடுது. ஸோ எங்களால ட்ரீட்மெண்ட் பண்றதும் எஃபெக்டிவா இருக்க முடியறது இல்லை. ஸ்ட்ரோக்ல என்னன்னா, எவ்வளோ சீக்கிரம் நீங்க வந்து ஹாஸ்பிட்டல், ஒரு ஸ்ட்ரோக் எனேபிள்டு ஹாஸ்பிட்டல், தட் இஸ் ஸ்ட்ரோக் ட்ரீட் பண்ற மாதிரி இருக்கிற எல்லா வசதியும் வச்சுட்டு இருக்கிற ஹாஸ்பிட்டலுக்கு வந்தீங்கன்னா சீக்கிரம் நம்ம ஸ்ட்ரோக்கை ரிவர்ஸ் கூட பண்ணலாம். ஒரு பெராலிசிஸ் நம்ம ரிவர்ஸ் பண்ணலாம், ஸ்பீச் பிரச்சனையா ரிவர்ஸ் பண்ணலாம். அந்த கேப்பபிலிட்டி உண்டு இப்போ. பட் ஸ்பீட், டைம், அதுதான் பிரச்சனை. ஸோ அந்த டைம் ஃபேக்டரை வந்து குறைக்கிறதுக்கு நம்ம ஆர்டிஃபிஷியல் இன்டெலிஜென்ஸ், ஏஐ யூஸ் பண்ணா இட் இஸ் வெரி குட். ஸோ நவ் வி ஆர் ஆல்ரெடி ஹேவிங் தி ஏஐ பாசிபிலிட்டி. ஸோ ஏஐ வச்சு ஃபியூ செகண்ட்ஸ்ல எல்லாமே தெரிஞ்சு போயிடும். இதுக்கு சர்ஜரி வேணுமா, இதுதான் பிரச்சனையா, ஒரு ஐவி மருந்து கொடுத்து சரியா போகுமா, இல்லாட்டா கேத்லாப்ல எடுத்துன்னு போய் அந்த கிளாட்டை வெளியில எடுக்கணுமா, எல்லாமே தெரிஞ்சு போயிடும் within seconds. So we don't waste time. அந்த டைம் ஃபேக்டரை நம்ம ரெடியூஸ், ஷார்டன் பண்ணிட்டா to the minimum, we can save more patients, we can reduce disability. So that is why the importance of AI. And இதோட we are also working with smaller hospitals. யார்கிட்ட இந்த infrastructure இல்லையோ, we can work with them using the AI to help more patients. So இதுதான் இங்க அடுத்த plan, and that is what we have launched today on our 2nd anniversary.
Thank you.
Thank you. Thank you.